Hi, Dr. Donald Murphy for Spine Care Partners and Primary Spine Provider Network. What we're talking about here is the training that physical therapists and chiropractors undergo as part of the pathway that you're a part of. And so, as you've seen in your training, the primary care training, we have set up a pathway here that's focused on primary spine care. And physical therapists and chiropractors have received a more in-depth training as to what their role is in this pathway. And so we thought it would be useful for you to understand exactly what their training consists of and how that fits in making your job easier in helping your patients maximize their ability to overcome the problem. So let's review the pathway. How does this pathway work and what does it mean to us? So we are setting up here a spine health program, and that consists of and is focused on primary spine care. And primary spine care consists of the primary care physician, the physician assistant or nurse practitioner, and the specially trained physical therapist and chiropractor. And we would suggest that about 85 to 90% of patients can be managed purely on the level of primary spine care. Now, there are certain patients who may require behavioral health or acupuncture within primary spine care, and we'll talk about how that works in the pathway. But again, the majority of patients can be managed in primary spine care. Now, importantly, you as a primary care practitioner and the physical therapist and chiropractor each have your own toolbox that we have provided for you that will consist of additional tools to help to manage the patient, to help educate patients, to use in the process of your management of the patient, additional understanding of certain subtopics within the topics that we're talking about in terms of the management of patients with back and neck problems, etc. All of this supported by the Primary Spine Provider Network as an ongoing support for maximize your ability to help your patients overcome the problem as quickly as possible in a seamless and straightforward way that is useful for everybody. Now, about 10 to 15% of patients are applicable to specialty care. And as you know, specialty care consists of invasive procedures for treatment, injections, surgery, and also diagnostic investigation, imaging, or medical specialists. So, the pathway. How does the pathway work? Well, the patient is at the forefront, right? So this is what the pathway is all about, is helping patients. And the patient will say, my back hurts or my neck hurts, and they enter the healthcare system. And within this pathway, the entry into the healthcare system is in primary spine care. They may see you, the primary care practitioner, first, or they may see the specially trained physical therapist or chiropractor first, at your discretion. So if you feel that it's important that all patients see you first, then that's your prerogative. If you feel comfortable in delegating a certain number of patients to see the physical therapist or chiropractor first, that's your prerogative as well, because the physical therapist and chiropractor and the primary care personnel work together as a team. And this is really important, and the seamlessness of that team effort is really important in the success of the entire program. So as we talked about, either the primary care practitioner or the specially trained physical therapist or chiropractor may refer the patient for behavioral health and acupuncture, and these are not carve-out things. In other words, behavioral health and acupuncture is provided in the context in conjunction with what the physical therapist, or chiropractor, or the primary care practitioner is doing. So they work together as a team, and that's really important. The primary care practitioner or the physical therapist or chiropractor may refer the patient for secondary spine care, again in the small minority of patients, but an important group of minority patients who may need specialty services. And so you may decide that you will want to take responsibility for making that referral to secondary spine care. That's perfectly within your prerogative, but understand that the physical therapist and chiropractor are trained to make this determination as to whether the patient needs secondary spine care or not, and can coordinate referral to them. So whichever way works best for you and what you feel is best for your patients is the approach that is most important. But understand that the physical therapist and chiropractor are trained to make this referral. What holds this all together, as we talked about in the primary care training, is relational coordination. That is, professionals working together as a team for the best interest of the patient. Okay, so what does the physical therapist or chiropractor pathway training consist of? Well, first off, it's important to understand that this training is not something new that we are coming up with, but rather this has been vetted, it has been studied, it's been investigated, and it has resulted in the training that we're presenting today. And so we have had a long series of conversations with other people. We have published our pathway and our results. So this is something that is well established in the healthcare system. So the first thing they learn is similar to what you learned about the problem of spine. And you know very, very well, and they do too, the problem is spine. But it's important to frame things this way because it's so important to understand how important it is that we bring greater value to spine, because the spine care is really a messy situation in our healthcare system. But then we get right into their role in the program and in the pathway. The expectations and responsibilities that they have to you in serving as a resource to the primary care practitioner, how to function within this pathway, and importantly, how to work hand in hand with you, and that is being an important resource to primary care personnel. We focus, as we talked about, on relational coordination, and we'll talk in a moment a little bit about what that means. We also, as we did with the primary care training, we focused a lot on the importance of wording. That is, the words that physical therapists and chiropractors use with their patients really goes a long way towards helping the patient on the way towards rapid recovery, or the opposite direction, which is what we don't want. Also important for them that is a little bit different than what a lot of them learn in school, is that the difference between applying treatments and managing the situation. That is, by and large, physical therapists and chiropractors have been well trained in how to apply treatments, procedures. But what we do is expand that for them so they understand not just how to do stuff to the patient, but rather manage the situation. So if that entails applying treatments, then they are trained to be able to do that judiciously. But also it's a bigger picture in helping the patient rapidly overcome the problem and to receive any services they may or may not need as they go along the process. And importantly, serving as a resource to you, that what they're put in place for is to help your job easier and maximizing your ability to help the patient, number one, to figure out what the problem is for the patient, but also help the patient overcome the problem as quickly as possible. Now, we talked about relational coordination and how important that is, and you may be familiar with this book by Gittell, where she did a large body of research that looked at taking the process that is used by Southwest Airline and utilizing that in healthcare. And basically, it's a way in which professionals can maximize their ability to work together and in a common goal towards greater value in the healthcare system and greater benefits to patients. So then we go into a lot of detail with the physical therapist and chiropractor on the biopsychosocial model and how that applies to spine-related disorders. So we go into a fair amount of detail into what specifically are the known biological factors that contribute to the spine pain experience, what specifically are the psychological factors that can perpetuate the problem, and what are the specific known social factors that contribute to an ongoing pain, disability, and suffering experience on the part of the patient. We then, again, as we talked about, focus a lot on language and how to apply the principles of cognitive behavioral therapy and acceptance and commitment therapy in communicating with patients. Mindfulness and meditation, not just for their patients, but importantly for themselves as well, because we emphasize how the idea of mindfulness starts with the practitioner. And so we help them learn how to be more mindful themselves, and thus by extension and by example, help their patients become more mindful. Looking at their own biases and the patient's biases, the natural biases that we all have as human beings, being able to look within at their own biases, but also helping the patient look at their biases. We also spend a fair amount of time on utilizing motivational interviewing in helping to motivate patients to make the changes in their everyday lives that help them to overcome the problem as quickly as possible and as thoroughly as possible. We also help them understand how to utilize outcome measures. That is, formal quantitative measures on how the patient is doing. Is the patient moving in the direction towards resolution of the problem, or are they not? And there are established, simple, but very useful clinically tools that they can use to measure how the patient is doing, and importantly, to report how the patient is doing to you so that you understand how things are going with that patient. So we then go into a good amount of detail on the differential diagnosis of spine-related disorders, and this is based on the 3 questions of diagnosis. Number 1, is this a visceral problem or a potentially serious or life-threatening illness? So so-called red flag conditions. So they are trained in detail how to suspect the possible existence of one of these problems, which is, of course, very, very, very uncommon. Where is the pain coming from? So is the pain arising from disc, joint, nerve root, myofascial? So there are historical factors, examination procedures that allow the physical therapist and chiropractor to make that determination. And what are the perpetuating factors? Impaired motor control, nociplasticity, psychological perpetuating factors, and again, there are historical factors, there are questionnaires, there are, in some cases, physical examination factors that help them to identify those important perpetuating factors. And then we get into utilizing the 3 questions of diagnosis in establishing the differential diagnosis, and then applying management strategies to help the patient overcome the problem. So when it comes to diagnostic question number 1, then the decision-making may be diagnostic investigation, certainly, but that may entail contacting you and letting you know that, boy, I think that there's something else going on here, that perhaps, if you don't mind, you would take a look at the patient and let me know if you think that's the case too. Or it may mean the physical therapist or chiropractor making the referral for imaging or specialist referral for diagnostic purposes. And importantly, if the physical therapist or chiropractor take the lead in referring the patients for imaging or specialist referral, apprising you every step along the way what their decision is, what their rationale is, what they're recommending for the patient, and keeping you apprised as to what the results of this diagnostic investigation has been. Now I'm going to stop for a second, and you see the asterisk there with imaging. What you may find that, depending on where you are, what state you're in, and the regulatory factors that are in place, that you may find that, for example, a physical therapist may not be allowed to make a referral for imaging such as radiographs or MRI. When it comes to a chiropractor, if the patient is covered by Medicare, Medicare, as it stands right now, chiropractors have the legal rights to refer a patient for imaging, but Medicare won't reimburse if the referral comes from a chiropractor. So in this case, these cases, the physical therapist or chiropractor may call you up and say, I think maybe an MRI would be indicated because I found this, this, and this. If you agree, would you mind making the referral? And so that is a necessary factor that, in our experience, won't disrupt your workflow tremendously, but it may be necessary. And again, diagnostic question number 1 is relevant in a very small number of patients. So these kinds of diagnostic investigations should be in a very small number of patients. So then number 2, based on the diagnosis, they address the pain generator, if it's disc, joint, nerve root, or muscle. We focus on, in their training, patient self-care first. So how to start with and place primary focus on the patient self-managing the situation, and then manual therapy and exercises as an adjunct to help the process along. And also details on how they can manage the perpetuating factors through motor control exercise, through the application of the principles of CBT and ACT and the utilization of motivational interviewing, pain education and graded exposure, as we talked about in the PCP training for patients who have nociplasticity, and how to utilize acupuncturist and behavioral health in the context of managing the patient. And importantly, the physical therapist and chiropractor are trained how to manage the patient across the full cycle. That is, when the patient first comes in and sees the practitioner, whether it's you or the physical therapist or chiropractor, how to guide them along the entire cycle towards resolution of the problem. And this is a seamless and continuous process rather than functioning as a specialist perhaps that would do their work with them and then they are back to you to figure out what to do next. The physical therapist and chiropractor are trained to take responsibility if you choose to have them do that, and to trust them to do that, to guide the patient along the full cycle depending on what is needed for that patient at any point across the cycle. And again, utilizing behavioral health as needed, utilizing injections and surgery as needed depending on the situation. Okay, then we get into case-based learning. So they learn through cases. And here's where we present cases and we discuss the process of the cases. Focusing on, in the context of managing a patient, how to work as part of the primary spine care team in conjunction with you. And we emphasize how they can make timely and efficient communications with you. So how they can, in a seamless way, make sure that you're apprised as to exactly what is going on with your patient every step along the way. And we circle back to utilizing relational coordination in working hand in hand with you and with other members of the pathway to make sure that the patient gets everything they need when they need it. Okay, so that's, in a nutshell, is the training that physical therapists and chiropractors receive to be on your team, to function on the primary spine care team with you. So if you have any questions or concerns or comments about anything we've talked about here, feel free to contact us. Primary Spine Provider Network is in place to support you in this process of the spine health program and functioning within the pathway. So we're here to help. Thank you.